Watu fikiria bleeding disorders is just about bleeding, but it's not that. It's about identity, resilience, kuface social stigma, social isolation, because wasa wajui what hemophilia, sickle cell, ama the vulnerable disease is. So today I'm diving deep on male and female lived experience, what they go through, and on the basis of treatment, identity, on the basis of diagnosis journey, and on the basis of that peer support, that support from the support system that at sometimes unapata wanawachukulia ni kama they are just a burden in the family, but ukiongea nao chini vizuri watakuelezea how they feel inside, how they usually unlock that self-infinite possibility as a blood disorder patient. So I'm Pius Opalakadi, a founder and a CEO of the Voices of Shuja and How to Himo Shuja, a peer counselor and a lived experience patient as a Shuja. Let's all be an advocate. My mission is to always raise awareness so that watu wasikie enough our voices, our cries, so that we get that support that we really need. Si upitia vitu mingi, but sasa hiyo understanding from the environment makes us even feel encouraged or feel demoralized. So today, let's all build a community that can even ignite hope into a more approachable and into a more encouraging world and encouraging support system. Let's get into it. First reaction, ukipata that uko na blood disorder, utapatanga unakuwa confused, out of denial, because you don't have that knowledge to say that I can decide on what I want. So let's all learn to become first, know that there are gender differences, know that men and boys, men or boys, why me? Am I different? These questions comes about. Na mimi pia nijiuliza, kwani mbona Mungu amenichagua? But I took that step and I understood that it's just a condition na naweza kuishi nayo. But it calls for you being your own advocate. Kama ujipendi, hata kama uko na blood disorder, how will you even live fully while facing even social stigma, while facing even social isolation, while even advocating for your own needs? But it's until sisi wote tukam pamoja, it's until you know yourself better. Be self-aware. Women and girls, why is no one believing my pain? Madam uko misdiagnosed a lot because unapatanga hawajui what they are going through, but it's until we all come together, it's until they learn how this spreading awareness, how this talking out to your needs can help them ignite hope in their life. So let's help each other grow. Let's all come together. Go to the Voices of Shuja, like, share, and subscribe so that reach out that unknown blood disorder patient. The Voices Shuja, we are now lived experience patient, talk out their what they've gone through as living with a blood disorder, how they became bold enough to start speaking out on what matters in the ground, and it can even ignite hope in your life. So go there, reach out, and you'll be empowered to live fully with a blood disorder. Do you know what? Diagnosis is not the end, but wewe mwenyewe utafanya ikue on the end. If you know how to hold the pen and continue writing the story, kila kitu kwa shava. Kama unanidigi, put subscribe button there and comment your thoughts. Diagnosis is not the end. What do you think? Right now, there are treatment options. Back then, hakukuwa na treatment options. On the basis of today, there is prophylaxis. There's a new treatment which is gene therapy, which is focusing on replacing, or we will be able to create our own clotting factors. For sickle cell and the vulnerable disease, there is also that gene therapy. There is the vulnerable way that can they treat, and there is even tranexamic acid, which I sometimes use if there is no factor. Back then, I used to use factor 9, but ukipata ikiisha, I'll have to use the tranexamic acid. It helps, but it has some cautions. You don't have to use it all the time. You have to be careful so that you even rely on the hospital and your health. There's no access in Africa, and so that your access ikuje, we'll have to come together to advocate. So that your access ikuje, we'll have to be united as one, as a Shuja, so that we unlock that self-infinite possibility. The emergencies that we go through is something that need to be taken very seriously, because ukiacha ikue kubwa, unapata that place gets even more worse. So let's all be gender specific on what the person is going through and help the person heal. Help the person B. Feel comfortable while sharing news to you. It's easy to at least unlock that self-infinite possibility if you support the person. But if out to support the person, how will the person even feel? Heavy menstrual bleeding. If you find out that you can have heavy menstrual bleeding, what does that tell you? You have to go to the hospital so that you be diagnosed, so that you even check if you have a blood disorder or not. But if you're just there, it will lead to misdiagnosis of even that vulnerable disease, or even it will lead to you now starting saying things that are not there. So, sports injuries in males. Wanaume, tusicheze, and kama unacheza, make sure uko na factor. Not that nasema ufai kucheza, but hard sports needs treatment. Hard sports need factor. Without factor, you can't play well. Using treatment, under treatment of women, you'll find out that there's no enough treatment, there's no access to health equity. But we're making sure that through awareness, through advocacy, we'll get whatever that we want on the ground. So if I may ask, what treatment routine changed your life, or what treatment option changed your life? Comment your thoughts. Always stay a shujaa on what you're doing. Do you know why I became a peer counselor? Peer support, and even it helped me tackle depression, social isolation, and to face social stigma. You have to have your own support network. You have to have your own support system, and you are the one to create what you want to be done in the community. If utanyamaza, vitu tafanyikaje, but if utajibonga, if you need that support from the parents, from the hospital, you'll be guided enough so that you craft that what you want to see. Kila kitu ni rahisi, but if you are your own writer, include others so that it becomes easy for you to write a more compelling story. Sisi kama wanaume si hide pain, but usinyamaze all time, because when you are quiet, things might turn upside down, and we'll all need space to at least share what we have inside. As human beings, we are free to share, but if umejikazia, how will it be? Women normalize pain and need validation. No, be vibrant enough to reach out, plus medical literacy. You have to be a health literate person. You have to reach out that hospital so that you be aided enough to unlock that self-infinite possibility. How online communities saves life. Through my WhatsApp group, Voices of Shujaa, you'll find out that you can join, by the way, and you'll feel in a space where now you'll meet people that have bleeding disorders and how they live fully. So reach out and you can be aided. So what conversation in your life changed the way you tackle things in your community? So how do you overcome stigma in families? Stigma can be overcome, but it's through you learning how to talk out your needs. It's through you learning how to put boundaries. It's through you learning how to listen to your body, so that other people in the community understand, other people in the family, in your friends, understand that you're going through a blood disorder that needs you to be careful, so that they treat you like careful you are. But if you're not careful, how will you be treated in this environment? How will you be taken care of? As a shujaa, know how to write your story, and always know how to ignite hope in people's life. It's easy. Through groups like KHA, you can even ignite hope. You can even be a person that can even craft that you are missing in your community. Let's all come together, and through access programs, we're looking forward to for 2027, 2026 to start crafting programs, but they are there, like the Shujaa Camp. If you want to access, reach out, you'll be able to get the help that you need as a shujaa. So using media and storytelling, I use my story to reach out that unknown blood disorder patient through me, at least accepting who I am, so that I use my voice to empower someone out there who doesn't know how to live fully with a blood disorder. So be your own advocate. And what did you wish your society understood sooner about even people with blood disorders? That's a question that I need you to answer. Do you know the part of doctors that can help us? It's until you learn how to advocate. Ukiona uko na pain, Go to the hospital, go to that doctor, tell the doctor what you're going through, and atakuassist vile inafaa. But sasa ukinyamaza, utaassistiwa aje? Just actually, surely, utaassistiwa aje? Take care of your needs and be that shujaa that you want to be. But if you want to unlock that treatment, that mindfulness, that even build resilience around you, you have to include people that usually give you drugs. You have to include people that can even ignite hope in your life. So be a shujaa, stay grounded, and you'll be able to write your own story. So this is a message. This is a message to the shujaas, caregivers, healthcare providers, and those watching. Let's all be shujaas in whatever that we do. Let's all not judge in what we don't know. Like, share, and subscribe so that we reach out to that unknown blood disorder patient. Stay shujaa.